This is a video of an arthroscopic excision of bone fragments developed after a neglected fracture of the lateral process of the talus in an 11-year-old soccer player. The fracture occurred during a soccer game 6 months before the procedure. Preoperative X-rays showed a non-union of the lateral process of the talus and an oval-shaped bone fragment. CT images revealed a minimally displaced hypertrophic bony fragment and a loose body between the talus and the calcaneus. 30 degrees arthroscope was inserted from an anterolateral portal. Soft tissues around the talus were removed with a shaver through a medial portal. Then the lateral aspects of the subtalar joint and the calcaneofibular ligament were visualized. The lateral process presented as an osseous overgrowth. A loose body impinged between the lateral process of the talus and the calcaneus was also visualized. The osseous overgrowth of the lateral process of the talus was then resected piece by piece with a shaver and a punch. Following partial resection of the lateral process, a freely movable loose body was well visualized. It was then totally removed and blocked with a punch. Shaving of synovitis and arthrofibrosis affected tissues was done with a radiofrequency system. Additional resection of the fragment was performed with a punch. When it was difficult to determine whether the fragment is being correctly resected, the position of the instrument was confirmed with fluoroscopy. No hypertrophic bone fragments or loose body remnants were observed on CT scans taken 1 month after the surgery.